Hi Calgary residents, welcome back. Sorry we missed March, but I have a nice one here for you guys for April. Thanks Graham for providing us with the study. This one's going to be a little bit different. The pathology is pretty obvious, so look through it, and then there will be a question at the end that you can go back and look through the images, maybe do some reading. I will complete the answer in the same video just because we had a month gap and I don't want to take too long to get the answer to you guys. So here comes the images. Well, this is a short axis. And here's the question. So clearly this was a pericardial effusion of some significance. And my question to you is this cardiac tamponade? We know that cardiac tamponade is mostly a clinical diagnosis. And we have patients with fluid building up in the pericardium, causing constriction of filling of the heart with decreased diastolic filling and ultimately decreased cardiac output. With low blood pressure, as well as jugular venous distension with this obstructive shock. And then the other clinical sign not mentioned here is the pulsus paradoxus that we can see. Now, if you want to go and review some of the echo findings before you look at the study again, so here's it's a good reference, sort of targeted not to cardiologists but to emergency scanners. So something for you to look at. Before you go any further with looking at this video, I suggest that you read this study and then go look at the video again. So what are the echo signs for tamponade? Firstly, you would see a pericardial effusion. We do want to state that the size of the pericardial effusion doesn't really matter. A large pericardial effusion that's built up over a long time might actually have less effect on cardiac filling than a smaller effusion building up over a short period of time in terms of its effect on cardiac filling. The next thing you will see, so you see the fluid there, and then you're going to look at the right-sided heart chambers. You're going to look at the right ventricle and the right atrium at their times of lowest filling. And for the RV, that's during diastole, just as it starts to fill. And with the RA, it's during systole, and that's when the RA starts to fill, and they will just collapse down. This respiratory variation is not something that you would be doing as a POCA scanner, but it is something that we do in more advanced echo and in the echo lab, where we look at inflows through the mitral and tricuspid valves and seeing how much variation there is in inspiration and expiration. And then, of course, the other sign, and one that I always recommend that you guys do, is the IVC, and you would get this hugely distended IVC. So for those who like things more in writing than in pictures, the core echocardiographic findings of pericardial tamponade is that effusion with right ventricular collapse during diastole, right atrial collapse during systole, the plethoric inferior vena cava, and exaggerated respiratory cycle changes. And this is how that's going to look like. This is a video supplement to JAMA. They actually did a really nice job of that here. So we're going to look at this pericardial effusion and effect on the cardiac contractility during the cardiac cycle. This is a subcostal view. You can see the liver here, full circumferential pericardial effusion. And so we're going to look at those right-sided chambers. And they're going to help us with that. Put a picture over the top here and show us this right ventricular collapse as this fluid, pressure in this fluid exceeds the pressure within the RV. And that is a hemodynamically significant pericardial effusion. So just keep an eye on that. Right ventricular and right atrial collapse. Okay. And that's it for this Dare to Diagnose. Go look at our study, see what you think about whether there's tamponade or not. The other interesting finding about this patient is that they actually was actually a patient with dextrocardia. So if you see Dr. Bishop, you can ask me a little bit more about that and how they ended up figuring out how to scan this patient with, or I think it was actually situs inversus, how they ended up scanning this patient with a heart on the other side of the chest. Thank you very much for watching. Continue to focus on your focus. See you soon in the OR.